If you're going into an appointment and feeling like people are not focusing on what's important to you, you're going to feel quite disillusioned, and actually that might have an impact on the relationship, the sort of rapport that you developed.
Fellow Homo sapiens, my name is Torie Robinson and welcome back to Epilepsy Sparks Insights. If you're new or haven't done so already, please like and comment on this episode and subscribe to the channel so to support our mission to decrease the discrimination faced by and improve the quality of life of those affected by the epilepsies, and indeed get everybody appreciating the amazing epilepsy research out there. Now, the impacts of sleep upon the lives of people without an epilepsy are huge, but they hold even more significance for people with an epilepsy. In part 2 of 2 this week, with research fellow Georgia Cook, we shall hear all about the benefits of clinicians saying, "I don't know," to patients and families, the challenges of and positive impacts of positive effective communication upon patient and family quality of life, and finding time for effective communication between patient and clinician, not always easy. The importance of qualitative research engagement and how it complements quantitative research, and strategies to improve patient communication in an epilepsy trial.
My name's Dr. Georgia Cook. I'm a research fellow based at Oxford Brookes University. I am an academic and a researcher, so I predominantly do research with children, young people and families, as well as healthcare professionals looking to improve health and wellbeing outcomes for individuals and children, parents, families.
I love it when a clinician says, "I don't know, and I'm really not sure, but I'll find out." That is the most beautiful thing they could ever say, because you trust them more, and it's nice to have a bit of modesty, and it gives them opportunity to learn as well. So what do you think about that?
I completely agree, and I think that's something that came out of the work that we've done, and I think that's something that's come out as a finding in other work that's looked at communication between sort of healthcare professionals and patients, is that having open and transparent communication, even if someone doesn't know the answer and is honest about that, like you say, that can be incredibly valuable and actually help develop that relationship as well. And I think what families and parents really said to us is, we don't expect every individual that we come into contact with to have all of the answers or to know everything, but actually be feeling like you are able to bring up whatever is a priority for you at that time, because obviously needs change as well over time. That's something that came up a lot in our work, and what you might need at one point or what might be the priority for you changes over time. But the other thing, and again, this has come out in my sleep related research across the board with families, is that actually just feeling, if you have a negative experience, if you ask somebody about something and they sort of shut you down, or you don't feel like it's a valuable or essential topic to them, and we had people say, well, no one's ever said anything about sleep, and when we did try and bring it up, they sort of brushed it under the carpet and said, oh, we're not going to focus on that, we're actually going to focus on this other topic, which may well be seizure frequency and severity or medication or whatever it might be. That actually is sending the wrong message to individuals, because then they think, well, actually, if that person didn't value that or didn't think it was an important topic, maybe I shouldn't be bringing it up in the future. And then that's a vicious cycle, isn't it? People are put off.
How do you think the challenges and potential solutions to these challenges could impact people's quality of life?
I think hugely. I think, addressing these challenges, and I don't think it needs to be anything dramatic. It's just about sort of balancing that clinical need with the sort of compassion, empathy and understanding that actually, we need to sort of align priorities, healthcare priorities, with what are priorities for patients or families or caregivers or whoever we're seeing. And I think that's easier said than done. And I think, we all know communication can be really tricky, and it's really easy for people to misinterpret or misunderstand, or for there to be miscommunication.
Especially if you haven't had enough sleep or are feeling emotional, right? It's like that circle that you get stuck in.
No, I totally agree with you. But I think it is really, really crucial that we are sort of opening up communication channels, and that we're keeping them open, and that we are making it really clear to individuals that, any clinical consultation or interaction or appointment, it needs to focus on what's a priority to them. And I think actually, if you're going into an appointment and feeling like people are not focusing on what's important to you, you're going to feel quite disillusioned, and actually that might have an impact on the relationship, the sort of rapport that you developed. And I think what we learned hugely, we already knew, but what came out really strongly from this study is the importance of that communication, having that relationship. And I think lots of individuals with epilepsy in this study and in wider studies, feeling listened to, feeling valued, feeling like you can bring up those priorities is really, really crucial. And I think supporting those constructive relationships, it is really important. And I know it's something that I've been talking to a number of colleagues with at Oxford Brookes recently, is around sort of healthcare communication more broadly. How do we improve that? Because actually it's not always something that I think is in the sort of curriculum or the training or the continuing professional development. And it's really hard, right? Good quality communication can be really, really tricky, because what one person needs is going to differ to somebody else. But trying to identify ways that we can support that communication could be really valuable. And I think one really wonderful thing that did come out of the Castle trial, I mentioned Professor Lucy Bray, who led the patient and participant involvement sort of advisory group on the Castle trial. They actually developed some resources, some freely available resources based on the parents and children in the advisory panel's experiences about preparing for consultations, almost like a kind of checklist and some top tips to really highlight to people, that get them to think about the range of topics that might be important to them, not necessarily just the things that are asked from the healthcare professional side, but get the families, children's, parents, individuals to think about, what do I want to talk about? What's my priority? And really reiterate to them that can be whatever is important to you. It doesn't need to be things that have previously been on the agenda. And I think, resources like that are a really good first step. I think, they're not going to solve all the problems, because we need to educate and support clinicians as well as sort of patients or those who are going to the appointments. But I think those resources are fantastic as a sort of first step to get people to think about, what is, because sometimes people don't even know themselves, what's my priority, what's important to me? Because I think sometimes we all go into medical appointments and we think, oh, well, this is the professional, they know better than I do.
And they will lead as well, right? I think it's a culture thing as well. Because I know in some other cultures, they're just like, right, I'm doing this, right? This is what I want, But I just think sometimes, generally, maybe in the UK, I think sometimes we're a bit more like, you'll solve my problem, whatever it is, right? And
absolutely.
But also, just listening to what you've said about people putting together questions. I mean, I've suggested that to heaps of people too, and I think it's really valuable. But what could be a challenge, maybe, is that we'll have all these questions, but then we've got a really short appointment, right? So we can't cover all of what we want to. And also sometimes we're not, well, some of us are, but most of us aren't clinicians and don't necessarily have all the information that the clinician might have. And so prioritizing could be challenging for us. I think maybe would have to meet in the middle with the clinician. What do you think about that?
Time is a huge challenge. And I think from when we surveyed clinicians or consultants and sort of wider healthcare professionals who work in epilepsy care, they said exactly the same thing. One of the biggest challenges for them was time. They have these limited slots. And I completely agree with you. I think there is a need to sort of balance the clinical need and the sort of individual's need. And again, I really think it's easier said than done. And there's a lot more work that needs to be done in this space to really work out, how could we practically do this in the current context in which we are working. I think what did come out in this study is that epilepsy specialist nurses who support children and young people and their families can be a really valuable resource, who sometimes do have not necessarily more time, but sometimes are an easier option to speak to around some of the broader issues. But again, we have issues in coverage. Not everyone has access to an epilepsy specialist nurse, even though they should. So that isn't a solution for everybody.
Well, and indeed, it's actually a rather unique role to the UK. There's a couple in Australia, but, a lot of our listeners are from the US, from Asia. There's no such thing really as an epilepsy nurse. So if you have one, if your family has an epilepsy nurse, value him or her or they, and just realize how lucky you are to have access, because it's a rare thing. I was lucky enough to come to your sort of presentation on they're on the study before, obviously this is before the paper comes out and everything. And it was amazing to hear from people, researchers like yourself, and actually the families who attended, which were brill. But what I noticed was that, and I think this is brilliant as well, that you have invested a lot of time and funds into qualitative research as well as quantitative research. I do find that it's not necessarily sold overly well yet, qualitative research, or taken as seriously as I think it really should be. Tell us about that and the value of qualitative research when it comes to, kids or even adults with an epilepsy and quality of life.
So I think qualitative research is an incredibly important sort of tool or way to really understand experiences and to kind of give context to quantitative findings. So I think, whenever we're doing healthcare related research, I agree with you. There is a sort of bias to quantitative research, and that absolutely has its place. If we're looking at effectiveness and impact of interventions or drugs, then absolutely quantitative research is really valuable and really important. However, exactly as you've suggested, I think sort of the qualitative component, so understanding from those who've got lived experience, who've been through these issues, and what we really see is valuable on the Castle trial, and we have done a whole range of different sort of qualitative components, is you can understand, you can kind of add meat to the bones, I think is a nice way to think of it.
Yeah.
The numbers are the bones. The sort of qualitative data can sort of, add additional context and provide some sort of understanding. So I suppose a nice example of this is, we know in the trial that we developed, we produced a website. So the sleep intervention was a website. And what we found is that for those who used the website, it was helpful in lots of different ways. However, as with many sort of digital interventions, using it is not going to be right for everybody. There's a whole host of challenges, and we did everything that we could in this trial to make sure that people had access. So we provided iPads, we provided data to make sure that everybody was able to kind of access and use the intervention. But even then, we found that some families didn't engage with the sort of digital intervention as we might have hoped. And so what the qualitative component allows you to do, and Professor Bernie Carter from Edge Hill has led a really great qualitative component at the end of the trial to understand, what were some of the sort of barriers or challenges or facilitators for families, so that we can, in hopefully some future funded research, we can address those.
So what have you learned from your study into how you can improve communication in the future?
So I think the first is using sort of plain, simple language is really, really important. I think, when there's lots of acronyms and words and phrases that not everybody might understand or know, I think using plain language is really important. I think doing what we can as academics, researchers and clinicians to support individuals to bring to consultations, appointments, any issues that's important to them, and making those all feel kind of valuable. I think sometimes how things are said are as important as what is said. So I think for all of us thinking about, how are we posing questions? Are we sort of shutting things down before we've even started? So asking really open questions and really actively listening and engaging, and not just sort of asking the questions we're interested in and then, disappearing off in our own head while we're not really listening to answers. And I think relationships are absolutely crucial. So whether that's between participants and researchers in a trial or a research capacity, or whether that's between clinicians and patients, building a relationship and continuing to improve that over time is really, really valuable to make sure everyone feels like a valued partner in that relationship. So what we really think is important to prioritise open, honest, empathetic communication. It's not just about the information or the content, but the way in which things are presented to that kind of relationship and partnership, and really seeing it as a relationship. Many of the families we spoke to, what they wanted was to feel heard, respected, listened to, and included in decision making, even if it involved a bit of back and forth of, we don't actually know the answer to that, let's bring that up, let's come back to this, not expecting everyone to know the answers, but to have that communication channel open.
Thank you so much to Georgia for recognising and explaining the importance of effective communication between patients, families and clinicians in epilepsy research and care, and how the latter are totally cool with and can even appreciate when clinicians say they don't know the answer but will find out. Also, it's still not overly cool in research yet as a whole, but hopefully we're getting there. I really appreciate Georgia explaining the value of qualitative research. For if we are to understand basic data, we need perspectives, without which there can be total misinterpretation and missed opportunities to improve care for people with an epilepsy. You can find out more about Georgia and her work on the website torierobinson.com, where you can also access this podcast, the transcription and the video. If you haven't already, don't forget to like, comment and subscribe to the channel, and share this episode with your friends, your colleagues, your family members, the universities, the schools, even the playgroups. This supports our mission to decrease the discrimination faced by and improve the quality of life of those affected by the epilepsies, and get everybody appreciating the incredibly cool research that is out there. See you next week.